When we study the base of the skull or the cranial fossa, we know the cranial fossa is divided into an anterior, a middle, and a posterior cranial fossa. To make the study of this cranial fossa easy, first you have to master the bone called the sphenoid. You can see the sphenoid here. I'm just drawing the outline of the sphenoid. You can very well make out a butterfly, or rather we can say it's like the superior view of a bat, like this. So this, you can make out the sphenoid here, and there are two wings for the sphenoid, the lesser wing which I'm drawing here, and what is remaining is a greater wing. So this is a lesser wing of the sphenoid, and this is a greater wing of the sphenoid, and here in the center you have the body of the sphenoid. So this is the general structure of the sphenoid bone, which is very important to master the cranial fossa. Now, if you look at, if you imagine you're standing here on the body of the sphenoid bone, and if you're looking forward like this, you can see the ethmoid bone in the front, and on either side you have the orbital plate of the frontal bone. Okay, so that means the orbital plate of the frontal bone is located forming the roof of your orbit here, forming the roof of the orbit, right and left, and the ethmoid bone is forming the roof of your nasal cavity. So as we can very well know, nose is in the center, and you have the left and right eyeball on either side. All right. Now, if I go back, okay, here, the body of the sphenoid articulates with the basio-occiput, or the basio-occiput part of the occipital bone, and it takes up the shape of the alphabet Q. Okay, can you make out this Q alphabet here? I'm drawing it like this, okay, with a foramen in the center known as a foramen magnum, right, which we all very well know this. So remember, the alphabet Q is behind the sphenoid, with its base of the basio-occiput articulating with the body of the sphenoid. So these are the bones in the front and bones behind. And if you look at the side, you have the spreaded greater wing of the sphenoid here on both sides, which articulates with the squamous part of the temporal bone and bit of the parietal bone in the front. Okay, so here you have the parietal bone in the front and the squamous part of the temporal bone on either side. So now you can make out a gap between the greater wing of the sphenoid and the basio-occiput. This gap is actually a process called the petrous part of the temporal bone is actually pushing into this gap. Can you see this? So this is the petrous part of the temporal bone, which is pushing between the greater wing of the sphenoid and the basio-occiput here. So if you have an orientation like this, we can go to the next level. Thank you.